It's true that yesterday the cabinet met, and some of the resolutions include two important resolutions for the health sector. One is about the community-based health insurance, known as Mutuelle de Santé. First, the expansion of services. There are new services that were not included on the list of services covered by Mutuelle de Santé. And these are oncology services, cancer treatment, cancer diagnosis. This is something that people have been asking. This is something that we also, as Minister of Health, wanted really to have accessed by the people. But given the cost, given other considerations, this was not yet included. So this is one of the new services added to Mutuelle de Santé. The second one is about dialysis and renal transplant or kidney transplant. These are new services, especially kidney transplant. It was not accessed because it was not even being done, so it was started last year. Dialysis has been also accessed. The increase in numbers of people going to dialysis has been remarkable, but access to people is something that we know Mutuelle de Santé covers 92% of the Rwandans, and having this also accessible was very important. That's the second one. The third one is total knee replacement and total hip replacement. These are major surgeries that were not covered by Mutuelle de Santé, and yet we have many patients across the country, especially older people, the seniors who were not able to access it because it was too, I would say, too expensive if you pay out of pocket, but also not covered by Mutuelle because Mutuelle was the Mutuelle itself needs additional financing to be able to include these services. So we have, for example, mini-invasive surgery. We have other surgeries, advanced surgeries like cardiac surgeries that were not covered by Mutuelle de Santé. We have prosthesis and orthosis that were also needed by so many people, either as a consequence of accidents or something they're born with and they need to be taken care of. So in total, there are about 14 new services that I would say quite costly, that were not integrated in Mutuelle de Santé, but now they are integrated, which means people will access it, but also it means there is a need for additional financing to the scheme so that these services are paid for, are covered for. So that's why in the resolution of the cabinet, it includes also new sources of funds, where this money, additional financing are going to come from. So there are areas that are going to contribute. There are many sectors like the banking sector, the insurance sectors, and also the government contribution will also continue to increase so that these services are covered in addition to what we already have. So you may ask about, do we also increase the contribution of people, premiums on Mutuelle de Santé? Not now. Not now, because we know the people needs to be prepared. We don't need to put a lot of pressure on individuals right now, so the government put that into consideration. But this is something we'll continue to discuss, maybe not this year, but what about in the coming year if we add something in different categories, we include our contributions so that our scheme also includes other services that will be coming, especially technology, being treated better and faster. But it's not something that will come from heaven, it has come from ourselves. So people's contributions, the premiums, is something we continue to discuss this year and see the best time to have it implemented. And this is something also the people themselves will be sensitized about, and we don't want to rush it, but these new services needs to be covered by new sources of funds. At least we have a beginning fund to provide these services. So the aim is that those we can integrate right now will start immediately, like cancer treatment already started. Those we can add next month. We move on with insurance companies, particularly RSSB. And latest June, end of June, we would have covered all the 14 new services under Mutuelle de Santé. So that's the plan. And the other thing I can add is not that Mutuelle de Santé is important and we need to support it, but also if we treat early and faster, we benefit also financially and health-wise for the ministry, for the government. This is something we prioritize, and that's why this resolution was very important for the cabinet to make it happen. Yes, definitely. That's how we are approaching it. For example, the cancer treatment, cancer services. This is something you need to do quickly, so that you don't lose someone in his life, or you don't see someone progressing into another advanced phase of cancer. So we're looking into that. That's why this category is coming first. We already started. Dialysis and renal transplant is also important. It has been we already started to cover it under Mutuelle de Santé. Prosthesis and orthosis is important. Moving on to total hip replacement, knee replacement. We have already people on waiting list. We have lists across the country, especially people who had accidents or elders who have been suffering from this, waiting from these services, these surgeries. So these are things you can schedule, because surgeries also you don't, if you can schedule it, then it's something you can plan maybe in days. But if it's an emergency, it's an accident, and you have to do it right now, that will definitely start. That's why we gave ourselves 3 months' time to prepare and to integrate these services progressively, starting with those that the community population is looking for, is asking as soon as possible. Yeah, it's true that the second resolution of the cabinet on this Friday, January 17, was to update the tariff for healthcare services across public and private. And I would mention 4 elements that were constitute this resolution. Number 1 is that this tariff has been last revised in 2017. And from 2017 to today, a lot of things happened. A lot of things have changed on the market, on the pricing, on the access. So this has to be reflected so that our facilities continue to run. Secondly, there are many things that where the government invested, I would say upfront, and the services should be costed according to the investment already made. I'll give an example. Last year in July, the government purchased so many equipment, like X-ray, CT scans, MRIs, echography machines. So it's a big amount of equipment that were distributed across facilities. So the cost of the imaging services overall has reduced to reflect that already paid services. And if I give an example, if you do a CT scan for the brain, before you had to pay 4,500 Rwandan francs if you are on CBHI, Mutuelle de Santé, and RSSB would contribute 45,000 to support you if you are a member. Today, the new cost, you as a member, you are going to pay 1,600 Rwandan francs. And the remaining will be contributed by insurance. So from 4,500 to 1,600 is a significant reduction. That is an area where the services or the cost has reduced. So it's both adjustment to the market, but also reduction based on already covered, big part covered by the government, especially on this big equipment, big services. Number two, the tariff has been adjusted to different levels of care, but also different categories of clients. If you're coming from East African community, you're paying a tariff different from someone coming from any country of Africa, which there's an increase to that, but not a major increase to limit people's access. And someone from America or from Europe, from any other part of the world coming to Rwanda, also with an international insurance, for example, will add an additional to the cost of a citizen or someone in Rwanda. So these adjusted according to international standards of tariff, which were not there in the old, I would say, old tariff. And it's going to be much easier to automate it. It's already automated, the tariff. If you come with Mutuelle de Santé, you put on your number, you will see the category of tariff you're going to use. But if you come with a different type of insurance, let's say you're coming from any country outside Rwanda, outside if it's ESC, if it's Africa or beyond, there's adjustment according to that. So this is an international standard for health services tariff. So that is another aspect of that. Every 2 years, these prices will be adjusted automatically according to the market or according to the investment made by the government. So the aim is that we don't put a burden to the people, but again, those who can afford can also contribute something that help the system to continue run. So that's another consideration. Maybe something to add on is access to medicine at health facility level, especially the health posts, health centers. It has been a challenge for those small facilities to continue to supply themselves with a very limited budget if they had to treat first and then to go with invoices to ask for insurance to pay them. So we're also beginning we're starting a new payment modality called capitation with RSSB, where RSSB will be paying in advance or giving money in advance to health facilities so that they can be able to purchase medicine, to pay running costs and other services. And once they have already treated the clients under the insurance or other clients coming to the facilities, then they can be able to justify the invoices instead of going to bring invoices for payment. So for us, it's very important. Facilities will not struggle to have money to acquire these products on time. And then the people, the patients, will be able to go and access the product. So we're beginning with one province, Eastern Province. Then we will scale in the other provinces moving forward. So that is also very new. And we believe that this is going to improve the way small facilities have been running and have better prediction of what they will be doing with their clients, and even manage their resources properly instead of sending invoices and then waiting some time longer, sometimes shorter, without precision when they'll be able to get money to, again, start a new order of products. First is access. The first resolution we're talking about, how do we increase the services on Mutuelle de Santé so that people can access all these services. So I think it's for us, I mean, as a sector, but also as government, it's important that whatever you're providing in Rwanda is accessed by the people of this country. That's the main take home, I mean, the key message from this resolution. Second is that where the prices have been old, not updated, should reflect the reality on the ground. If we're purchasing a bread for 1,000 francs, and today it's costing 1,200, it should be the same for medicine. Because otherwise, both the facility will suffer, and the clients also will suffer, because if it doesn't match, the quality of care and even availability of those products is going to be a challenge, and we are going to face the challenge, all of us. So we don't have a situation where facilities are failing to continue to run, because if they fail, then we don't have where to go to seek care. So we have to balance both. So that is another key message. Another key message is there are services that were costed higher than the cost they should be asking, especially where the government have invested upfront. I mentioned the example of imaging. So imaging is very important because it shows where the problem is. And this is services that should be available to everyone in need. So before, in 2017, it was available in few places. Now it is becoming a standard, and even far from the city, the capital. So availability means that we are also going to treat better and faster and recover better and quickly, which at the end also we save some cost of delaying treatments or even losing lives unnecessarily because we haven't seen the problem. So for the sector, it's also good news that not only the cost of imaging is reducing, but also the early treatment predicts better outcome and less costly services at the end, because if you are too sick, then you need more care. So overall, it's a good step. We're very happy to have these two resolutions made by the cabinet, and we look forward to the implementation, and we look forward also to see how this change the lives of people on a daily basis and what we want to improve in our sector.